Every patient comes with a story of movement, of purpose, of hope. My mission as a surgeon is to help them reclaim that story. I'm Dr. Tigran Garabekyan, an orthopedic surgeon specializing in hip preservation. My passion lies in helping people move freely again. I've been in practice in Los Angeles for just over 10 years, and I have a unique philosophy to patient care. I prioritize spending time with patients so I can really get to know them and understand how their hip is impacting their life. And when I do a surgery, I personally handle all of the follow-up so that patients can get my input at every stage of recovery. For me, surgery is not just about repairing a joint. It's about restoring confidence, independence, and the quality of life that pain and injury have taken away. That's why I take the time to understand every patient's lifestyle, ambitions, and concerns, guiding them personally through every stage of recovery. 2 years ago, I partnered with Commons Clinic, a group that shares my belief that the patient experience matters most. Together, we've created a new model combining advanced surgical techniques with a deeply personal patient experience. We've built an environment where innovation meets empathy, where patients are truly seen and supported. But rather than hear it from me, I'd like you to hear it from Lauren, one of my patients who's a professional ballet dancer. I treated her left hip with a PAO in 2021, and she recently came back under my care for her right hip, which had become increasingly more symptomatic due to the underlying dysplasia.
I started dancing when I was around the age of 7 and fell in love with it. But all throughout my pre-professional training and then eventually career, there was always pain in the hips, which I just chalked up to being an inflamed hip flexor or overuse. And of course, we're encouraged to just push through the pain for the sake of the art. But it wasn't until after retiring, teaching, that the hip pain started to get worse, especially in the left hip. So I did an MRI and that showed a torn labrum. And then that's when I found you.
Was the technique that I used for the PAO a factor in your decision making? We had talked a little bit about the advantages with regard to allowing earlier weight bearing, more cosmetic incisions, smaller incisions, and just a less invasive approach, and also the safety in terms of protecting one of the big nerves in the leg, the sciatic nerve, knowing that we're going to minimize muscle atrophy in the leg. We're going to preserve the range of motion that's so crucial to your livelihood as a dancer and an instructor.
Yeah, that was a huge factor in the decision-making process. The stories I was reading and hearing about sounded like a complete nightmare. And then in researching, okay, well, what other surgeons do it in this way? It seems like there's very few who actually can do it in a way where you are allowed weight bearing directly after surgery. So that was a huge plus, and I think really made a huge difference in the recovery process for me, with the possibilities of preserving my own hip, but then also being able to continue in my career, which for me has been my life and my calling. It's really what made it worth it. So after recovering from the left hip surgery, it was the first time in my life I realized, oh my gosh, like, hip pain isn't just normal. Like, running, there was no pain. Walking, there was no pain, in a way I had never experienced before.
I'm excited to see her get through the next phase of recovery. We'll be advancing her weight bearing regularly until she's off crutches at around the 1 month mark, and then we'll be checking her x-rays periodically to ensure the bone has healed fully, at which time we'll remove the screws.
So this is my second time doing the PAO surgery with Dr. Garabekyan. This second time around has felt a lot easier. I think partially because a lot of thought and care goes into making that process and time spent in the hospital as effortless and painless as possible. Everyone that I've come in contact with at Commons Clinic has really been so friendly, so welcoming, and gone above and beyond in all of their communications to help me feel safe and supported and prepared for the surgeries.
Whether you're an athlete, a dancer, or simply ready to move without pain, we're here to help you return to your life stronger than ever before.